My name is Reyes. I'm a family medicine doctor at Lynn Community Health Center, and I am here to welcome you to get vaccinated. The vaccination in Massachusetts has opened up to more families, and we want to make sure that everybody that is eligible feels comfortable and makes the right decision for them. But I really do want you to please consider getting vaccinated to protect yourself and your loved ones. The COVID-19 vaccination, there are two vaccines that are currently available in the United States. One is the Moderna vaccine, the other one is the Pfizer vaccine. They are both safe. The list of ingredients in them is very short. The messenger RNA that's in them is not going to hurt our bodies, is not going to change our DNAs, is going to protect us from getting the COVID-19 illness. And after we get the second dose, about 2 weeks later, we should be protected somewhere around 95%. So this is a highly effective vaccine. The people who have had the COVID-19 illness should still get the COVID-19 vaccine. After recovering from the illness, we think that our bodies will protect us for maybe about 90 days, maybe a little bit more, maybe a little bit less. However, the COVID-19 vaccine is still important for people who have gotten the illness in the past. We want to extend our protection, hopefully for much longer. So in terms of contraindications to the vaccine, it is almost zero. The only reason someone does not want to get the vaccine would be if they had a really severe allergic reaction to the first dose of the vaccine or one of the ingredients. But there are very few ingredients in the vaccine, and it would be very rare for someone to have a severe allergic reaction to them. Currently in the state of Massachusetts, we have different phases in terms of who is eligible for the vaccine. At this point, anybody who is in phase 1, which means healthcare provider, police, firefighter, first responders, and any healthcare workers, including home health-based care workers, are eligible. We are now in phase 2, and the first part of the biggest priority group in phase 2 is people who are 75 years or older. Starting on February 18th, the state has moved to the next priority group in phase 2, which is people who are 65 years or older, including 65 years old, or people who have 2 or more medical conditions that puts them at higher risk of having complications if they get the COVID-19 illness. That list is a little bit long. Mostly is things like having had heart disease, like a heart attack or heart failure, severe kidney disease, having had an organ transplant. Pregnant women are included, people who smoke, people who have severe asthma, and a few other conditions that are included. Those people qualify right now in the state of Massachusetts to get the COVID-19 vaccine. To receive the COVID-19 vaccine, people have to make an appointment. There are different ways of making the appointment. Most of them are done online through the state's website, or different towns and cities have a few more places where you can get vaccinated. For instance, in the town of Nahant or the city of Lynn, people who live or work in Lynn and Nahant can get vaccinated at the Lynn Vocational Tech School on 80 Neptune Boulevard. You have to be either someone who lives or works in those towns or a patient of Lynn Community Health Center. And to sign up, you can do it through the Lynn City's website, through the Lynn Community Health Center website, following the links. For those of us who have a hard time signing up through the computer, if you live in Massachusetts, you can call the number 211. Again, that is 211. There are interpreting services on that number for many different languages, and they can walk you through the process of setting up an appointment. So for the COVID-19 vaccine, in terms of severe side effects, it is very, very rare. The main side effect that we try to watch out for, which is why we monitor people for about 15 or 30 minutes after they get the vaccine, is a severe reaction where they might have a difficult time breathing. Again, super rare, thankfully. I haven't seen any of those yet given the vaccine at the site. And the most common side effects are a little bit of soreness in the arm, feeling a little bit tired and achy, usually for 1 or 2 days, and they go away. If you need to get a little extra rest, take some liquids, drinking lots of liquids, and take a little bit of medication for pain, that will help out a lot. And within 1 to 2 days, you should feel back to normal. After the second dose, our body's immune response is usually stronger. It's not that the vaccine is making us sick. It's not that we're getting COVID or that we're having a bad reaction. It's just a normal reaction that our body is starting to recognize the virus more and is using up lots of energy to protect us and make more immunity. So we can feel a little bit more achy, a little bit more tired. But again, it's for about 1 or 2 days.